people who are caring for them in the system feel like they got someone to turn to as well.
Absolutely. So I guess it's a little bit after 8. We could probably go ahead and get started.
Sure.
Good morning, everyone. I'm Mike Soul. I'm a neurologist with U of L Health and U of L School of Medicine. By background, I'm a pediatric and adult neurologist. I'll talk a little bit more about that, but it's my pleasure to introduce our sort of kickoff speaker. And then I'll talk after Jessica, but Jessica Nickrand has been a colleague of mine a friend of mine for more than 5 years or so, but is part of the Child Neurology Foundation, formerly with the American Academy of Neurology. But the Child Neurology Foundation we were just chatting about is an offshoot of the Child Neurology Society, I'll say. It's the advocacy and education wing of the Child Neurology Society. And we're going to talk this morning about transitions of care for children with neurologic conditions and who are transitioning to an adult neurology provider. So Jessica, I'll let you share when you.
Sure. Thank you so much, Dr. Soul. It's really great to be here. As Dr. Soul said, we've been working together specifically in the area of transitions of care for a while. And today I'm excited to kick off, by telling you a little bit more about who CNF is, to set Dr. Soul up to tell you about one of the really exciting projects that's happening at your institution through this partnership. So if you're unfamiliar with CNF, as Dr. Soul said, we really began in partnership with the Child Neurology Society, which some of you might be a member of. But we position ourselves as a nonprofit who's still governed by physicians, still really plugged into this world, but one that supports caregivers and other stakeholders in the care of young children with neurologic conditions to serve as a collaborative center. And so what we really see our value of doing is, instead of trying to compete and vie with other patient advocacy organizations, to bring folks together. And so we really try to partner without pride, really, with other patient advocacy organizations, other institutions, just to continue the work of making sure that all children affected by neurologic disorders reach their full potential. And we very much believe that we need to support clinicians and other healthcare professionals as part of that process. And so something that I want to underscore, whether it's transition of care, whether it's figuring out how to enroll your patients in clinical trials, or how to talk to them about, epilepsy surgery, whatever happens to be, Child Neurology Foundation has supports not only for to refer your families to, but also for you as a clinician. We offer CME through our online learning portal. We offer grants. We support both QI research and medical treatment and research. And so if you go and you can go to childneurologyfoundation.org or scan that QR code to go to our website and sort of see some of the opportunities there. And I'll make sure that I put my email in the chat as well, so that if any questions come up while Dr. Soul is talking about this project, or even afterwards, you can contact me. So I want to highlight that the tools that Dr. Soul is going to be talking about are our 8 common principles and our transition of care toolkit. And we developed this about a decade ago now at this point, because we kept hearing from families and clinicians the transition of care is hard, and it's still hard. Obviously, we've been working on some of the systemic issues that make things more difficult. But what we really want to highlight is that using these tools, it allows you a process to evaluate the transition of care process annually. And you can use these tools to talk about, even though we're talking about the medical transition of care, you can use it to talk to your patients about housing, about education, about legal guardianship, things of that nature. And so as the transition of care becomes more complicated, frankly, depending on the particular case. Again, the importance of these tools that Dr. Soul is going to talk about, I think, really can't be undersold. Another thing I want to highlight too about the transition of care process is that something that we hear from caregivers all the time is that they feel like they're transitioning too. And so, obviously it needs to be patient-centered. It needs to be focused on the patient. And Dr. Soul is going to highlight the ways that we develop these goals to be very patient-centered, because that is a very core element to how we feel like transition should happen. But these individuals are really going through an identity change. Being a caregiver to a 16-year-old is different than being a caregiver to a 22-year-old, even if there is guardianship and things like that involved. So these tools allow you to, again, gauge if your caregivers are having issues or difficulty with emotions around transition care, but also the real, realistic, tangible things. Like there might be insurance changes, there might be changes to the young person's disability income, and they are going to have different care needs as caregivers as they age. And so those difficult conversations about secondary guardianship, what to do when the caregiver dies or otherwise is unable to care. Again, CNF is a really great resource. You can refer them to us to have some of these more difficult conversations so that you as a clinician can focus on the transition of care piece for the young adult and making sure that their medical transition is set. So with that, I'm going to pass it over to Dr. Soul, and I look forward to hearing from all of you. Thanks.
Thank you, Jessica. Let me get going here. Whoops. Sorry. Is that shared where everybody can see?
Yeah, it's not in slideshow mode though. I mean, we can see it, but it's not in the
Yeah, let me get
yeah.
it. There we go. Is it it occurs to me it may be on the wrong screen. Is it on the wrong screen?
Yeah, it's on the wrong screen, and it looks like you're sharing the one that I just presented to.
Oh, right. Okay. Let me minimize that. The yeah, it's an IT limitation. I have two screens and I
Totally.
so,
No, I mean, people can see it. It's totally fine to.
okay. Does that work?
It's still your view, but if that's what we got, that the slides are viewable.
Okay. I apologize for that. I'm not sure how to. There's probably a button down here, but I don't want to fumble around and waste time. But so welcome this morning. I'm again Mike Soul, pediatric and adult neurologist by training. Switched over to adult neurology and with U of L Health about 1.5 years ago, and am passionate about improving transitions of care for children with neurologic conditions to the adult neurology provider. So the Child Neurology Foundation has been a partner with me on this. For 4 or 5 years, the history that actually predated my involvement directly with the Child Neurology Foundation, but even beginning in 2011, it began to be clear that this was kind of a problem that needed a defined scope. And then an authoring panel finally published a paper that was endorsed by American Academy of Neurology, American Epilepsy Society, Child Neurology Society, and American Academy of Pediatrics, involving 8 principles for transitions of care. And then the TPEC committee was formed the same year, and this is morphed into the Transitions Expert Panel, which I'm a member of for the Child Neurology Foundation. But this is individuals who advocate for children with neurologic conditions and do a number of activities involved with this. So the idea is that there are 8 common principles for transitions of care that these were developed several years ago now, but with an expert panel of child neurologists, authoring a paper in 2016, but with the idea being that adulthood is coming, they need to plan for it, that there are several components involved in transitioning your child to an adult provider, and we'll kind of go over those. So a yearly self-management, what are your personal goals for transitioning to an adult provider? A discussion medically of the needs of the child and preferences of the child and the parent or caregiver as to who they might transition to. Evaluation of legal competency. So guardianship is an important component, and we'll talk a little bit about guardianship and various legal aspects. And then a transition plan needs to be developed over time. So typically, we ask that this transitions process begin around 12 years of age or so, that you review this plan annually at least and discuss with the child during routine visits. But then typically children with neurologic conditions, particularly neurodevelopmental disorders and subsequent intellectual and developmental disability, have a multidisciplinary care team. And so who else is involved in the care of this patient, and how will we make that transition with those other providers? And typically we'll want to be able to then identify an adult provider and in the perfect world, we know everything about the adult providers, but the child neurology and adult neurology groups, I think, need to work closely together on the transitions of care. Back in the day, it was, referral patterns occur for a variety of different reasons. You always want to try to refer to somebody who's nice, but somebody who's also competent and skilled and willing to accept that patient. So referral patterns used to be just who did you know from who you saw in the doctor's lounge, and of course that's not necessarily ideal. But increasingly, child and adult neurology don't necessarily hang out in the same circles as much, and so we need to make an ongoing concerted effort to work together between child and adult neurology to have a smooth transfer of that child to an adult provider. And this is, of course, all pediatric specialties kind of, are interested in this, but there are unique challenges that occur in children, particularly with neurodevelopmental disabilities, in transitioning to an adult provider. So the Child Neurology Foundation came up with this toolkit. It's now 7 years ago or so, 6, 7 years, maybe 8 years ago. And